Hello, my name is Artur Valerievich and I teach anatomy. And today we're gonna speak about thoracic and lumbar nerves, about anterior branches and the nerve they create. So, at first, about thoracic nerves, I already told you that they are not create plexus. They not connected and they just go in intercostal spaces and have name nervi intercostalis, intercostal nerves. Like superior 11 pairs of thoracic nerves have names nervi intercostalis. Last one, 12, have name nervus subcostalis, because like the same artery, because it's not situated in intercostal space, it's situated under 12 rib, so it have name nervus subcostalis. So intercostal nerves, again, they situated in intercostal space, accompany arteria and vena, the same name, and give us a lot of branches, and motor and sensory. So motor branches, they give to all these muscles, all these intercostal muscles. It supply musculus intercostalis internus, musculi intercostalis externi. If we talk about superior 7 intercostal nerves, they also supply musculus transversus thorax and musculi levatores castarum. If you talk about lower 6 intercostal nerves, or even 5, they innervate muscles of abdominal cavity. They innervate the musculus obliquus abdominis externus, musculus obliquus abdominis internus, musculus transversus abdominis, and even musculus rectus abdominis and subcostalis. All these muscles that are on the walls of your thoracic and abdominal cavities. So, if you talk about sensory branches, as you can see here, it gives two sensory branch. One here, originated on the level of linea axillaris anterior, the level of anterior axillary line, and second, here on the level of like parasternal line, linea parasternalis. So these have name nervus cutaneus lateralis. It's lateral cutaneous nerve. It's anterior. Cutaneous anterior. So this lateral cutaneous nerve supply like this area of your lateral thoracic wall, and anterior cutaneous supply your anterior thoracic wall, and you can see them here. So this is anterior nervi cutanei anterioris or rami cutanei anterioris, and this is lateral one. As you can see, they also divide on like anterior and posterior branches that supply skin of your and thoracic and abdominal. Also, as you can see, abdominal cavity and walls, abdominal walls until this level above inguinal ligaments. So this is sensory branches of intercostal nerves, and we can speak about third and fourth anterior and second and third lateral sensory. These cutaneous branches, they gives these terminal branches for mammary gland. Last one, it's nervus subcostalis, here it is, and then we proceed to lumbar region. There you have big plexus. Actually, we have one big plexus there that calls plexus lumbosacralis. But it's comfortable to divide them on two plexus. But they united, as you can see, there is a big like lumbosacral trunk, truncus lumbosacralis, that unite these two plexuses. So we start with plexus lumbalis, lumbar plexus. It's formed by anterior branches of lesser part of thoracic 12 nerve, then lumbar first, lumbar second, lumbar third, and greater part of lumbar fourth. These spinal nerves form your lumbar plexus, and this is how it looks like and where it's situated. So your plexus lumbalis actually, as you can see, situated in front of transverse process of lumbar vertebrae, actually inside this muscle. Plexus lumbalis is situated inside musculus psoas major, inside this major psoas muscle. And all nerves, all branches of your lumbar plexus go out from under the lateral margin of this muscle, or from under medial margin of this muscle, or even we have one nerve that actually penetrate this muscle, that go through and laying on this muscle. So let's start. And first one, here you can see it, it's nervus iliohypogastricus, iliohypogastric nerve. Nervus iliohypogastricus, as you can see, it's going forward and downward. It's laying on quadratus lumborum, and then it penetrates and goes between transversus abdominis muscle and obliquus abdominis internus. It goes between these muscles. It also gives like this lateral cutaneous branch, and in the end it gives anterior cutaneous branch. And this nerve actually supply skin right above inguinal ligament. It's anterior and lateral branch. Motor branches of iliohypogastric nerve innervates these muscles where it's situated. It innervates and musculus quadratus lumborum, and transversus abdominis, and obliquus internus, and obliquus externus, and also it can reach like rectus abdominis and even pyramidalis, and supplies skin above inguinal ligaments and above symphysis pubic. Next one, right below it, you have the second nerve that also come out from under the lateral margin of musculus psoas major. It calls nervus ilioinguinalis. Ilioinguinal nerve, it goes like it's parallel direction to iliohypogastric and to iliac crest. It also laying on quadratus lumborum, then it's laying on internal surface of your abdominal wall, and it reach the deep inguinal ring. You remember canalis inguinalis that have superficial and deep ring, annulus profundus, in lateral inguinal fossa. So this nerve goes to this ring and go through it. It goes through this opening and enters canalis inguinalis, go through canalis inguinalis, then exit here through a superficial ring, annulus superficialis, and divides in the skin around the superficial ring, and innervates skin right in this area of superficial inguinal ring, and gives also branches to external genital organs. It terminates with these branches. In males it calls rami scrotalis anterioris, in female they will be rami labialis anterioris. Motor branches supply the same muscles that supply nervus iliohypogastricus. It supply transversus abdominis, obliquus internus externus, and quadratus lumborum. Third nerve that came from under the lateral margin of psoas major, it's nervus cutaneus femoris lateralis. It's lateral cutaneous nerve of your thigh, and as you can see, it also have parallel direction to your ilioinguinal nerve, and it goes to spina iliaca anterior superior, to anterior superior iliac spine here, and then it goes under your inguinal ligaments. It go under inguinal ligaments, and then came on your thigh, and there it penetrates fascia and situated on the skin and terminal branches, and supply skin of your lateral aspect of your thigh until your knee joint. And in the name, it's cutaneous nerve, it have no motor branches, it's just sensory. And the last one, nerve that came from under lateral margin of musculus psoas major, it's the biggest nerve of your lumbar plexus, it's nervus femoralis, femoral nerve. It's go down and go also under inguinal ligaments through spatial space. You remember lacuna muscularum. It come to your thigh, and there it will branches. It gives a lot of motor branches and supply this anterior group of muscles, and not only. As you can see, it gives motor branches to your musculus quadriceps femoris. You remember rectus femoris, vastus lateralis, vastus medialis, vastus intermedius. It's quadriceps femoris. Then it supplies musculus sartorius, and also, as you can see, it gives branches to musculus pectinus, and it's also supply this musculus iliopsoas. Also, it have few sensory branches. As you can see, on anterior, it gives anterior cutaneous femoral branches. It calls rami cutaneae femoris anterioris. That that innervates skin of your anterior thigh region. But it also gives one more long, very long sensory branch that calls nervus saphenus. Nervus saphenus, it will accompany 3 different vessels. First of all, it goes down with arteria and vena femoralis. You remember they go in this triangle and enters canalis adductoris. Adductoris canal, it goes with these vessels, but then it leaves this canal. This nerve leaves this canal with another vessel. You remember also arteria descendens genus. We talked about it previously. It's accompany arteria descendens genus and leaves this canal through anterior opening, give this infrapatellaris branch, ramus infrapatellaris, that supplies skin under your patella, and then goes down on your leg, and here it accompany vena saphena magna. It accompanies the great saphenous vein, gives branches to the skin of your medial aspect of leg, then it go in front of your malleolus medialis and land on your foot, on medial margin of foot, and reach even your distal phalanx of your great toe, and supply skin of this. As you can see here with the color, it supply skin in this region. From under your medial margin of your musculus psoas major, we have one nerve. It's nervus obturatorius. It's obturator nerve that, as you can understand already, that accompany the same artery and vein and go through obturatorius canal. Go through canalis obturatorius, then go on your thigh, and there divides on branches, on anterior and posterior branch. Anterior branch, as you can see, go down and divides, gives branches to medial group of muscles of your thigh. It's, you remember, it's musculus adductor longus, adductor brevis, adductor magnus, and gracilis. And posterior branch go backward and gives one sensory branch to your hip joint, to articulatio cocci, and supply this musculus obturatorius externus. And nervus obturatorius gives one more sensory branch in this lower part. As you can see, it gives cutaneous branch to the skin of your thigh. In this, here you can see it in this lower part of your thigh, innervates a small area of skin right above your knee joint on the medial aspect. And the last one, it's this nerve that actually penetrates your musculus psoas major. It calls nervus genitofemoralis. Genitofemoral nerve, it go through this muscle, then laying on its anterior surface and go down. Go down until like lower part, and there it divides on 2 branches. Genitofemoral nerve, it's easy, divides on genital and femoral branches. Medial, it's ramus genitalis, genital branch. Lateral, it's ramus femoralis. Ramus genitalis, as you can see, it goes down and forward, and actually it penetrates posterior wall of your inguinal canal. It also goes to inguinal canal, but it's not terminated on the level of superficial inguinal ring. It goes down. If we talk about males, it goes into scrotum, it is supply musculus cremaster, remember that? It supply tunicus of your scrotum and even tunica dartus of your testis. If you talk about female, it's situated next to ligamentum teres uteri and supply this ligament and external genitalia. And the last one, it's ramus femoralis. Ramus femoralis, femoral branch, it's go to lateral side and also go under the inguinal ligaments in lacuna vasorum. It go in lacuna vasorum to the side laterally from arteria femoralis, and there it go under the skin. It supply skin straight under the inguinal ligament. This area in the area of hiatus saphenous. So now you know that branches, nerves of lumbar plexus that supply area of your abdominal wall and thigh. So first of all, we have this area above inguinal ligaments. That skin is supplied by this nervus iliohypogastricus, iliohypogastric nerve supply this area. Next, near the superficial inguinal ring, we have nervus ilioinguinalis that branches here and supply skin in this area and also external genitalia. Next, under the inguinal ligaments, you have ramus femoralis, nervi ginta femoralis, that supply this area under your inguinal ligaments. Laterally, you have nervus cutaneus femoris lateralis, lateral cutaneous femoral nerve that go down, supply this lateral aspect of your thigh until the knee joint. Anterior aspect of your thigh will be supplied by nervi cutanei femori anterioris, that are branches of your femoral nerve. And in the lower, only in lower part, you have small area above your knee joint from the medial aspect that is supplied by nervus obturatoris, anterior branch of obturatoris nerve. That's all for today, I guess. Thank you for your attention. Ask me some questions, subscribe to my channel, and see you later. Peace.